Good evening, dear Foxians. It's privilege to welcome you all for Gyan Pravah, Flow of Knowledge, the podcast series and visit under the dynamic leadership of Dr. Sunita Tandulwadkar. I am Dr. Sejal Nayak, chairperson of Fogsi Endoscopy Committee, honored to host this platform every month, bringing you insights and wisdom from legends in our field. In just 6 months of as a president of Foxy, Dr. Sunita Tandulwadkar has achieved transformative milestones that many dreams of their in entire life. Her visionary projects like Sampurna, Know Your Numbers, Gyan Pravah, Do Ke Zindagi Ke, Anubandh, and Eagle have revolutionized the women's health across country, reaching every member and fulfilling her vision of Swasth Nari Samruddha Vatan, her Ghar Foxian. Her initiatives encompass every aspect of care from adolescent health, preconceptional care, antenatal care, and safe motherhood, from endoscopy, oncology, menstrual hygiene, vaccination, and even spiritual and environmental wellness, creating impactful change at every level. Today, we delve into the revolutionary topic in gynecology, Transplanting Hope, a gynecologist's guide to uterine transplant. We are deeply honored to have with us an eminent Dr. Sailesh Puntambekar, whose pioneering work in uterine transplant has given new meaning to fertility and womanhood. This daily podcast of Gyan Pravah itself is a testament of Dr. Sunita Tandulwadkar's innovative leadership, a living library featuring legends from medicine, art, politics, entrepreneurship, spirituality, igniting us become better version of ourselves with each episode. With 161 episode, she continues to inspire and motivate thousands of us every day. With immense respect and admiration, I now invite our visionary leader, mentor, the inspiration, Dr. Sunita Tandulwadkar, to address us and to introduce this enlightening session. Good evening, dear
Thank
madam.
you. Thank you, Sejal. Thank you so much for your kind words. But that really, when you enumerate so many projects, I really feel ki I don't know how we designed those projects and how we are performing, how we are implementing. But 6 months journey tomorrow, 9 January, we have taken over, and 9 July, we will be completing 6 months of a journey. And I think God has kind enough to be with us all throughout this journey, from designing to implementation. Shailesh, thank you so much for coming on a Foxy platform. I know your love for Foxy and love of Foxians way for you. That's why I think even before I take over, we gave you fellowship in ICOG because you trained thousands of gynecologists, not only of India, but all across. So thank you for coming on a Foxy platform, and I'm sure Sejal will take the best of the interview ever. And this will be one of the most memorable and most viewed podcast, and Sejal will share the link with you, which you can share to thousands of your friends across and the students. Coming to Sejal as an endoscopy committee chairperson, Sejal, you started, I still can't forget 2011, never knew that this girl has so much of potential, that she is not only working in Foxy, but she will preside the most prestigious organization of India, that is IAG, and we are eager to see what she will do in her year. Because just as a Foxy endoscopy committee chairperson, Shailesh, having Eagle project, if I say 6 months we have finished, she is going to celebrate in July the 100th of Eagle, involving 300 and plus endoscopic surgeons she has involved all across. And I don't know, Actually, this is a IAG project altogether. I'm very clear from the day one. 2019, we curated this as a IAG president, and I want IAG to continue this because it's very difficult to get the endoscopy chairperson like Sejal anymore in lifetime. But what is important is this year in Foxy, every city I travel, they say we have done Eagle or we wish to do Eagle. Raipur Society has done 5 Eagle projects. I was shocked to hear that. So, Sejal, thank you so much. You are absolutely dependable, very skilled, very experienced gold medalist of your time. And it's a proud privilege that we know you and you belong to my inner core itself is my proud moment. I'm wishing you all the best. Shailesh is a great orator, teacher, and I'm sure you will bring out the best from him. Thank you. Thank you, Shailesh, and thank you, Sejal.
Thank you. Thank you.
And thank you for always blessing us. And would it's a privilege to introduce the legend, Dr. Sailesh Puntamekar sir. Today's we are going to discuss about the gynecologist guide to uterine transplant. What do you call a surgeon who dared to dream beyond scalpel, who turned that what was once considered science fiction into the science milestone? You call him Dr. Sailesh Puntambekar, a pioneer, a mentor, a master of modern surgical art. From founding the globally renowned Galaxy Care Multispeciality Hospital in Pune to crafting the celebrating Pune technique of laparoscopic radical hysterectomy, Dr. Puntabekar has consistently transformed how we understand and perform pelvic surgery. But perhaps his most inspiring achievement, performing India's and Asia's first successful uterine transplant, giving birth to not just a baby, but to a new era of for women once told they could never become mothers. His surgical journey has reached over 25 countries, with his techniques touching thousands of lives. As the only Indian surgeon to win the Golden Telescope Award multiple times at prestigious AAGL and to perform live cadaveric dissection at Global Congress, Dr. Puntambekar blends brilliance with humility, science, and soul. He is not just a doctor, he is a force. He is not just a surgeon, he is a storyteller of human resilience. And today, he joins us to share his extraordinary chapter, How Wombs Found a Way, the Science Gave Hope a Heartbeat. So, thank you so much honoring us today on this large platform of Foxy. More than 46,000 members are here as of your viewer.
Thank you, Sejal. Thank you. Good evening, everybody. Thank you at the outset. Let me thank my very close friend and always very good encourager, Dr. Sunita Tandulwadkar. We are in the same city, and very rarely will you see each person from the same city appreciating another person. And that's what we are for last 30 years. And this relationship just goes beyond just the relation of Foxy president, and she's a close friend. And anything that she tells me to do, I will do it, and of course the vice versa, all anything for Sunita. So it's a pleasure to be here. She always told me the moment she becomes the president, I'll be doing the podcast. And of course, he gave me the ICOG fellowship also. And of course, with you, Sejal, it's always a pleasure. I know you for a very long time, a very accomplished surgeon. But the most important thing is that you have literally groomed into a very good orator, very good organizer. And of course, I would always call you like Nokia, connecting people. That's what you are. and, and that's how you should remain. And yeah, I'm very more than happy to share all my experience. I hope that our podcast serves as some kind of inspiration, some kinds of inspiration to people who were born in India and they feel that it's the misfortune that they are born in India. It's a misfortune that they are born in Bhopal. Had they been born in Bombay, they would have got better opportunities. City doesn't matter, the dreams matter. Sunita has proved it long time back, being the first IAG president from Pune being the first women president from Pune. And of course, she's now going to be on the AGL board. I'll make sure that she's there. So, it's not the geography, it's your dreams. And that's what matters. And that's what mattered to me when I did the uterine transplant. So, thank you very much. I'm really looking forward for a great interaction during this evening.
Thank you. And Shailesh, our pattern is you and Sejal remain in the frame, and I will be joining the viewers link to see you. So
Okay.
that, my chairperson who really work hard, they deserve the complete platform and the showcase. Thank you
Okay.
so much. I'll
Okay.
join that.
Bye. See you there. Yes.
So, sir, to begin with, as we all know, globally, over 1.5 million women suffer from absolute uterine factor infertility, and roughly 1 in 500 women of reproductive age are born without uterus. How did you recognize the need of the uterine transplant in India, and what inspires you to pioneer this revolutionary step?
Well, Sejal, it all goes with a story. I was never even thinking of uterine transplant over the period of years that I developed myself in gynae oncology, from total laparoscopic hysterectomy to radical hysterectomy to exentrations and then urinary diversion. So I had almost performed everything that is possible in laparoscopy for gynecological cancer. And in 2015, when I had gone for the AAGL annual conference, and 2014, the first baby was born in the world out of a uterine transplant. So I had gone there, and there was a guest lecture by Dr. Matt's Brainstorm. And he was a guy who had the first baby. And he had a guest lecture on how the baby was born and how the wonderful thing has happened, that how this has happened. And my wife, Dr. Seema, who's also a gynecologist, she also always attends AAGL with me. So she said, let's go and listen to this lecture. I was not interested because I thought, okay, this is something which is not my topic. But then she pulled me. And he was a great orator. The invention that he did was great. And as he was talking, it was 2 hours lecture and everybody was glued. At the end of 2 hours, as they were discussing the technique, he said that I took 14 hours to take out the uterus. And then suddenly it struck me. Why did he take 14 hours to take out the donor uterus? And then he showed the incision from zipisternum to pubic symphysis. So, being a laparoscopic surgeon, that really hit me hard to take out a donor uterus. And because till that time, it was only live donor surgery. You cannot do cadaveric transplant, brain dead. So that actually set my mind in motion. That what is it that it requires 14 hours to take out the uterus? And in this era of robotic and laparoscopic surgery, why should the donor suffer from such a big incision? So, with this thought, I came out of the auditorium, and probably I was the only person who was a little bit baffled. There was a standing ovation for him. He deserved it all the way. But these thoughts came to my mind, and then I kept on wondering what is the technique, why they are taking 14 hours. And we realized that it is a very tedious dissection of the uterine artery and the internal iliac vein. But having been done exentrations in galore and published, I wondered, can we do this laparoscopically? So this was 2015. Then the next question came, did we do the transplant immediately? No. It took us 2 years. Now, why did it take us 2 years? Because it is not something that we dream of something and then we immediately go and execute. You have to study this in details. So the first step that I did was to go to Matt's Brainstorm. And I went there taking his appointment in the month of January, minus 20 degrees cold in Sweden, in Gothenburg. And in spite of giving an appointment to me, he decided that he will not meet me. So two of my colleagues, Dr. Milind Telang and Dr. Pankaj Kulkarni, joined me for my craziness, and I'm very thankful to them. So we went there. We went to his office at 9 o'clock as he had called and waited there till 6 o'clock, but that guy refused to meet me. Next day, the same thing happened. But in these 9 hours, we scanned everything in his office, from the articles that he had written, from the technique that he had followed. And that was our study period. On the third day, He finally met us for dinner very reluctantly, and he said, okay, if you guys are interested in transplant, I will come and do it in India. But the caveat is that none of you will be involved. You just keep the patients, and I will come with my team to do it. In this excitement that we may be able to do this transplant in India, me and my two colleagues said, yes, that's fine. And we actually celebrated because we thought we've done a great job. We got Matt's brainstorm coming to India. But then I requested him that how should I train myself? So he said, there is no way we can train you. But being not jumping to the bandwagon, I decided that I should train myself. And then I went to Germany and to Italy every 3 months, worked on the cadaver, did laparoscopic surgery, shut myself with one cadaver, and went and tried to understand the vascular anatomy in such a way that could be done for transplant. So 6 to 8 hours every day with single cadaver, working like a man with vision, 2 years and almost 12 cadaveric dissections. I did just myself alone and trying to work at the vascular anatomy, which was very, very important. So it took me 2 years to understand that there are 9 branches of uterine artery, how the internal iliac artery divides and where we should take it for the entire anastomosis, how we can take the internal iliac vein, which seemed very dangerous. So it took us 2 years. So it has been a full effort to go to this level. And then finally, in May 2017, we did the transplant, thinking that Matt's brainstorm will come and definitely help us because we had signed a deal with him. And on 3rd of May, he said that I am not coming unless you pay me $1 lakh. I didn't have that money. And I said, well, and we had almost announced that we are going to do it. And that's when our team members decided that forget Matt's brainstorm. You have worked hard. Let's do it with you as a team leader. And when Matt's brainstorm refused, I never knew that I would be creating a history by doing the first ever laparoscopic retrieval of a donor. And on 17th May 2017, we did laparoscopic retrieval of the uterus for the first time, and it has become history. We published it. But the thing I wanted to tell you is that it was 1% of inspiration with Matt's brainstorm talk, but rest 99% was a perspiration, a huge effort on me and my team members.
So amazing, sir. I'm just thrilled to listen the entire story and your resilience, sir. In spite of all these obstacles and challenges, you continue and you pursue to master it. So that passion which is seen in your, we always observe you in sitting in the auditorium and your, the all the steps of the surgery and the clarity of the anatomy, the mastery. That is really something unique, sir. Sir, over 100 uterine transplant we have now been like globally have been performed, and nearly 70 live births have been there. So how does India's journey, so especially your contribution as Asia's first uterine transplant and into this rapidly evolving global landscape, where do you see India right now? And was
Actually,
it like that difficult to get this all the platform ready to perform this technically very challenging surgery?
That's a very good question, Sejal. I have just been an author to the globally getting published article on uterine transplant as it stands today. There is a uterine transplant international society which has been formed. I am one of the members, and today only I signed the copyright because we have together written a paper about what is the future of uterine transplant. So there are two aspects. One aspect is the ethical part of the entire thing. That is number one. That is the most important thing. And the second part is the technical part. Technical part, Sejal, is not so difficult. Now, why do I say it's not difficult? Because when I did my first radical hysterectomy, uh, there were only 180 radical hysterectomies done in the world at that time, and there were multiple uh, techniques. And so that the first one done in 1991 till 2003, when I did my first radical hysterectomy, only 180 patients were operated laparoscopically. And the question that I asked was it so technically difficult to perform this, or were there no duplicable steps? And that's how we started doing radical hysterectomy in a way that it could be easily duplicated. Today, I see so many Indian surgeons doing the pararectal dissection the same way. So, duplicability remains the key. And technically, what we have published, and we were the first to publish the technique of uterine transplant, what we have published seems duplicable for two reasons. One, because it does not involve internal iliac vein, it just involves ovarian vein. Taking an infundibulopelvic ligament is a very simplest thing for any gynecologist. And if we can master the internal iliac artery anatomy, which is also very difficult, not difficult. So technically, I am seeing a huge number of revolution in our country. From 2015, I am seeing great surgeons. I've seen you developing, you're doing the pararectal dissection as if you're doing day in and out. Think about it about 10 years back when looking at the ureter was taboo for a gynecologist. I see so many youngsters in IAG. I'm so proud that they are regularly venturing into the retroperitoneum and operating very, very nicely. And that's a big, big tribute because they have mastering this anatomy. So I don't think there is a technical problem. The problem is number one, ethical, because a lot of IVF consultants still feel that surrogacy and adoption is a better option. And the reason is because there are three operations involved. One is when you put the uterus inside the recipient, number two, a cesarean section, and number three, removal of the uterus. Now, if I tell you that the next transplant that we are doing, we are going to put the uterus also laparoscopically. Cesarean section will be done, that is necessary. And we have already taken out the uteruses of the people who have delivered laparoscopically. So finally, there will be only one operation, which is quite common in women's life. Ethically, what is the problem is that the question that people are asking today in the world is that does this kind of surgery is so much needed when already there are so many people who are there for adoption and there are so many women who are ready to do surrogacy. But as you know, surrogacy is altruistic in majority of the Western world. In our country, you know the rules better than what I know. And adoption is easier said than done. How many people would love to have adopted child? Everybody wants biological children. That's the reason IVF units are booming. So we are at a very big crossroad about this ethical thing. And that ethical thing will only come after too many people start doing this. So there was a team in Chennai, they did it, but they didn't call an Indian surgeon. So they called people from outside and they got the transplant done in Chennai. In Ahmedabad, I came and did the transplant with Dr. Vinit Mishra. But if you have to do technically, there are too many patients who are likely to do it. And I really would be happy if there are some support groups because the cost of the transplant is just 14 lakhs. It's not very big. But I'm sure if we can give and train better surgeons, transplant would be a viable option for people who otherwise have no hopes, like absolute uterine factor infertility, where the uterus is not there or the uterus has been taken out due to cesarean or hysterectomy. So these are the people, absolute uterine factor, they are the people who are likely to benefit. Just imagine when I did my first transplant, I had to struggle to get a patient. Today, we have 1,200 patients MRKH. Tell me one gynecologist in your entire area, how many of them you have seen 1,200 MRKH patients? They are registered with me today. So this is a hope. Now, obviously, I alone cannot do it. I would love to train more people, but people have to show the interest. And it's a team effort. You require a vascular surgeon, you require an immunologist, but I'm sure it will pick up. if people start understanding the need and they will start doing it. So we are at a very big crossroad. I don't think that it is going to be a regularly performed surgery, but one day it will become if people get technically trained for it. And last point is in India, we still have a law, obviously you know about it, that we cannot have unrelated donors. In except India, all around the world, wherever the transplants have been done, they have been always from the nurses who have donated their uteruses to the recipient. So they are nurses between the age of 45 and 50. The first one was the nurse. She was 50 years old. She had a pity for a lady who didn't have a child and decided to donate her uterus. But that is not allowed in our country. So we have our limitation that only mothers can donate or sisters can donate. So that is a big limitation. And obviously so, because in our country with the kidney transplant scandals going on, government doesn't want to take any risk. But if they allow us to do unrelated transplants, so many hysterectomies are taking place in our country. These uteruses can be used to for the donors. And of course, the law also states that we cannot do a transplant unless the patient is married or is in steady relationship. So these two laws in India are a little bit prohibitive at this present juncture. And there has to be more debate. So if there has to be more debate, more people have to do the transplant.
Sir, what I admire is you not just only a great surgeon, but also great teacher. You want everyone to learn this, and that is why you standardize the steps and make it so replicable that each one are inspired at least to achieve few steps towards you, sir. So it's a wonderful to know, and the obstacle stills are there in the country. And as you said, more people coming, joining together will have a more benefits to the general population and the public. So, what about the success rate of this such a complicated procedure, and which are the factor which are like very important or critical to get achieve the best success out of this?
This is a very good question. The biggest obstacle that all of you have to understand is the graft. What is a graft? Graft is the uterus. That is a graft. When any transplant surgeon, when they say graft, its kidney is called as a graft or the liver is called as a graft. So it is a graft in a transplant language. The graft has to be correct. So we are right now doing the transplants only of mothers. 80% of them are postmenopausal. So we are giving tablets to induce menstruation and then we are doing it. So the receptivity of the uterus for the embryo is not that great, and which has been proven by a lot of transplant surgeons. So they are advocating ladies between the age of 40 to 49 or 50 with a history of delivery. So you cannot have a nulliparous uterus. So you have to have a history that lady has delivered through that uterus. If we start using that uterus, the success rates are more. Just to give you an example, Dallas has done 28. Dallas hospital in Dallas has done 28 transplants. And out of 28 transplants, they could have babies only in 6. They also were prohibited by the fact that they wanted to use related donor. But look at Sweden. Sweden has done around 19 to 20 transplants, and their success rate is almost 70% because they have used unrelated donors. They have used sisters, they have used unrelated people who are willing to donate their uterus, who are in a very healthy uterus state. So if I get a good graft, then we will get good success. When the first baby was delivered with us, the woman's mother was just 48 years of age. So she became pregnant and delivered. The second lady that we got had 7 or 8 abortions because her mother was 51. Rest, we had all our mothers, we are 55 plus, and there were no sisters. And we did that, but we didn't have rejection. Though we didn't have rejection, our success rate right now, because out of the 9 that we did, what happened with 5 is 5 people during the COVID time refused to travel to our place, and we were not able to give the immunosuppressant drugs, which came free to everybody. All these transplants have been done free by me. So these immunosuppressant drugs, which cost 35,000 rupees a month, we were not able to send them during the COVID times, and they were not ready to buy it. So 4 of them lost their uterus because they did not take the drugs. So right now we have 2 people who are ready to be transplanted with the embryo. The success rate IVF is 40% as of now in all transplanted women, if you take it collectively. 70% in Sweden, 30% in Dallas. We also have 30% rate of success. So it is same like IVF, but the success rate will become much more if we use the correct graph. And I don't know, I don't want to be the advocate for unrelated donor, because if anything illegal goes on in any part of the country, I would be the person to take the blame. So I am not pushing for unrelated donors at this present juncture. But you have to understand, if I get a uterus who's less than 50 years of age, that would give you the best fertility results. So we are now doing one whose sister is giving at age of 45, and I am sure that we will be able to produce the child immediately.
So we heard about the story of your first uterine transplant, but we are equally eager to know more about the first birth. Being an obstetrician, that is how you feel about so India's following the India's first uterine transplant in the World Web. Could you just share some stories? How was the aura of the theater? How was the emotional
Yeah,
environment there?
that was the eureka moment, but that eureka moment was a little bit tough. So when our transplant lady became pregnant, it was my very learned decision. Me, and especially I should give the credit to my wife Seema, who decided that she is like your child now, and you cannot discharge her. So for 7.5, 8 months, he stayed in our hospital with the home food coming from our place every single day. Being a Gujarati, the lady was Gujarati. She wanted only vegetarian food and freshly cooked. So every day we used to send her dal rice and everything. And we took care of as if my daughter has got pregnant. The biggest problem with the transplant is that she had 2 abortions before she became pregnant. And these abortions are painless abortion because we do not transplant the nerves, so we don't come to know that there is an abortion. They just bleed and it just happened. So third time when we transferred the embryo and then it went, so we had a lot of hiccups. The first hiccup was that people told us that you will have teratogenicity because of the immunosuppression. So then, not being an obstetrician, I'm not an obstetrician. So then I learned what is an anomaly scan. So I attended the anomaly scan. And the lady, the fetal medicine lady who was doing anomaly scan, was looking at my face and said, "Why are you getting excited?" I said, "Why are you getting excited?" Meaning the baby is as if it's my baby. So, so and then she showed the legs and then everything. And then we were so excited. And as the pregnancy progressed, the lady started gaining weight. But then I came to know that she's got IUGR. Now, this was a big obstacle. So, what is IUGR? I had a big team of obstetricians. They said there is a IUGR, she's not growing. So, they added more steroids. And slowly and steadily, she went on progressing till about 30 weeks. And when she became 30 weeks, we were very sure that we will be able to save the baby. That time, the baby's weight, as per the scan, was just 1250 grams. But our pediatrician and the neonatologist said, this is perfectly fine. So we were just monitoring her every day. And one day, on 17th of October, of the sudden, she was absolutely fine. In the afternoon at around 1 o'clock, she complained of severe headache. So we went and saw the blood pressure. It was 210 by 120. So he immediately called a fetal medicine guy who also has done fellowship with me as laparoscopy. So he came with all his things and he then started doing. And that's when I learned about this amniotic fluid index, this was a complete Chinese word for me. So he said, "Sir, amniotic fluid index has gone down to 4." I said, "So?" He said it is critical, and you will have to do something immediately. So by this time, everything, then they gave some medication, the blood pressure came down, the baby, her headache came down, but the moments were not all that good, and everybody was worried. And then this guy said, I think I am seeing a little bit of the NST they did. They said she is okay, the baby is okay, but we cannot prolong it for too long. At the 30, it was 30 weeks and 5 days, and we were not sure whether what we had to do. So when everything was getting organized, the next step was, in 8 out of 10 deliveries in transplant that have taken place, they had to do a cesarean hysterectomy because the bleeding didn't stop. Because methergin and all that you use does not cause involution. So we had to make sure that our vascular surgeon is there. We had to make sure everything. So organization took place, and then we decided that we should shift the baby because our hospital is only laparoscopy and cancer. And then again, my wife said, no, you are not shifting the baby. Whatever you want, I will create the ICU here in 2 hours. And you will be shocked. In 2 hours, we had a team of neonatologists bringing all the ventilators, everything that is needed in one room. And we created the ICU in 2 hours. By that time, it was 11:30. We took the patient inside. And then one of my colleagues said, sir, 17th of October, half an hour before your birthday starts, can we wait for half an hour? That didn't strike me till then, that she's going to be delivered on 18th October. And everybody said, yeah, let's wait. And then at around after 12 o'clock, Dr. Milind Telang took the incision. Everybody was praying. And then he took the incision, he did the cesarean section. And when he delivered the baby, for the first, almost for a minute, the baby didn't cry. And then everybody, everybody was like, what have we done? Have we got this? And 1 minute later, the baby cried, and everybody in this entire hospital had tears in their eyes. It was as if our baby was born. It was as if we have had the first baby, and it was Dasara day. That day it was Dasara, very, very auspicious. Everybody had tears in their eyes that this is the baby. And then they said, Apgar score is very good, baby is fine, 1450 grams, and they will make it survive. And she is a female, so female will 100% survive. That was the first thing the neonatologist told me. I have two daughters, I knew how they fight, so I was very proud that we have created a girl. But we had, a lot of us had a lot of tears in our eyes. And then the next question was whether the uterus will involute, and we tried everything. The uterus, as if, went back to the normal, as if in normal delivery. It's literally our fate, God's grace. And if anything you want to do in universe with your pure heart, everything just goes correctly. Everything went off well. For 1.5 months, the patient, the lady, the girl was monitored in our hospital with the neonatologists working round the clock. And they also got paid for it, but they later on they thought that they are doing a very noble job. So I'm very proud to say that this entire process, the entire team members in Galaxy have not taken one single rupee. Not Dr. Telang, nor Dr. Pankaj Kulkarni, who did the IVF, nor my vascular surgeon, no anesthetist, not even neonatologist. All of us do private practice. Where is it that you see such a dedication? I'm just totally grateful to them, to my entire people, that they believed in me when I didn't even know whether I'll be successful. So I think we just cannot forget 18th October 2018. And this was a great moment for us. And at 4 o'clock, when we came, everything was over, we went to a pharmacy, found some sodas, we bribed the guy to give us some beer, and then drank at 4 o'clock till 7 o'clock in the morning, and everybody was drunk. So this is something that we did.
Deserve to
All
have
that
that.
law we could break. We just, because of our contacts, we could break everybody, and we were dancing, and you know what? It was a great thing. So it was a moment that we could never forget. And everybody was in Fogsi, the FIGO conference in Brazil. 150 Indians were there in FIGO, not necessarily from India, but all around the world. and somebody posted on Facebook that India's first transplant baby, and I got call from almost everybody from Brazil, because Brazil is 8 hours behind us. So till everybody came to know that we have got the baby. I think that was a moment we cherished, and nobody knew. And then when we came out of the theater, everybody said, Shailesh, do you realize that we have created history? All this came after thought. This was not done for success. This was not done for popularity. This was just my dream, which came true. I was seeing the culmination of the effort that I took for 3 years, the effort that and the promise that I gave to the lady that I will give you a baby. And this is something which I will be grateful to God and my entire team members for helping me to achieve my dream.
It's beyond the scientific achievement. It's like self satisfaction beyond the limit, the miracle you are holding in your hand, and the hope what you have given to the lady, you are fulfilling it. What a moment it would be. Uh,
Yes,
and
it was.
it's really a proud moment for even your team to be the part of it.
Yes,
So
yes.
it's thrilling. I'm having goosebumps right now. Beyond the science, what is deeply emotional procedure, equally for you, maybe equally for patient also. So you have come across many patients. So how this uterine transplant, the entire procedure and the outcome, they impact their psychology, patient's perspective.
So, I'll tell you a story. Once we did the first two transplants, and uh, the ladies, the mothers who had given the transplant, so the reporters came and asked them, okay, how do you feel that you have given the transplant? You've given your uterus. Uh, so they said, we feel this is the biggest donation that I have done. But the thing is, after the surgery, when we went and asked them, are you getting any pain? Do you feel anything? They said, what pain? I have no pain because I have done such a noble task. This was a classical mother. So, I remember that there was a story in Indian mythology that a boy treats his mother very badly because his wife doesn't like his mother-in-law. And finally, his wife tells his husband, that I don't like your mother, and you need to kill the mother and bring her heart to me. So then only I will love you and I'll stay with you. So he kills his mother, takes his heart in her hand, and he's walking towards the area to cremate. When he stumbles and the heart falls down, and the voice comes from heart, "Beta, tumko to taklif nahi hua na." This is mother. I really understood what mother is when I did this transplant. We always say mothers have more connections than the fathers, but that is what I actually experienced it. When the mothers didn't have pain, all they were worried about is, how are my daughters? Will they become pregnant? This is unbelievable. This is humanity beyond understanding. We all get satisfaction by treating the patient, but we never get this satisfaction of donating an organ and being happy about it, losing a part of your body, but being happy about it. So it is a great experience, and we still continue to have this. We are getting so many people who are saying chicken first, egg first. Please put the transplant, do the transplant. My daughter is not getting married. I see, and 90% of these MRKH women are really beautiful looking because they have excellently progressing ovaries. They are functioning very well, but there is no uterus, so it's an estrogenic effect. And they all are every day falling at our feet. So please do the transplant so that I can get my daughter married. But the law doesn't say so. I don't know. This is a very emotional kind of thing that I have to play every week with at least three patients coming in and falling at our feet. But it's an emotional thing, and finally, science is more important than emotions. So we have to look at it. But yes, transplant is all about emotions, and we experienced it completely. I think that was the most fulfilling moment.
Miraculous, sir, and it is so inspirational. You have excellent surgeon to masters in the gynec oncology, then the cadaveric, from the transplant, and you learn the obstetrics also, even neonatology, to get one passion or the one goal. You have to give your everything, everything. You have to be so dedicated and perseverance towards your goal. That what we can learn from you, sir.
Yes.
Amazing. Sir, apart from the psychological like you have trained more than 400 Indian surgeons and 150 international doctors. So what do you see the future of our endoscopy, and what do you see in your students, how they vary in their performance or in their futuristic looking towards the futuristic aspects in the endoscopy? Are they are equally passionate? Are they are equally motivated, or it's just a momentary while they are with you only?
No, I think I have seen a world of change. When I started training people in 2005, it was with a little awe that, well, only he can do it, but I won't be able to do it. And that's what I hated maximum, because I always wanted that to be like, you can do it too. But since 2015, as I said earlier, in the last 10 years, I have seen one of the best surgeons being groomed with the same passion. I see myself in them, a lot of them, the same passion, the same kind of enthusiasm to do every surgery as if it is the last surgery of their life, which is what I tell my students, that every surgery should be done with that passion, that this is your last surgery, because there is a life under your knife. And whenever you have a life under your knife, it is not about what you are to eat in the evening, where you are to celebrate. First, complete your job. I'm seeing the same passion. And not to name one or two, but more than 50 surgeons I can name in India today who are doing excellent work. And I'm so proud of them that I have trained a lot of them. But I just trained them, I inspired them to do this. But now what they are doing is on their own. The kind of endometriosis surgery that I see now, the kind of dissections that they do, they are far too superior. They are far too better than me. And I'm sure that, it's an evolution process. When I became and came to the, at some level at the top, I dislodged somebody who was already there doing a good job. And there are people who will do better job than me. There are surgeons who are better than me. And I don't get jealous, because I feel that I have created a legacy. This legacy is growing. I have created a passion which is also going. It's not only about technically doing the surgery, but understanding the surgery, trying to train. I'm seeing so many people, Sejal, you yourself are doing Eagle project. Tell me 5 or 7 years back, where there are many organizations trying their level best to teach people. You want to give what you know. And this is what matters, because your contribution to the society is not about earning money. Your contribution to the society is about giving what you have learned, and you are doing it equally well. So I am so happy. The only regret that I have at times, and which I keep on saying in a lot of conferences, that in spite of my busy schedule, if I can have 128 publications, 6 books written, what is it that the youngsters need, that even at AHL we are not seeing many people coming and presenting their work? I keep on saying, not for the sake of this, Indian surgeons, especially the youngsters, are the best I've ever seen. The problem is that we are happy in our own herd. We should be going towards the internationality, and people will believe when they see you operate. So that's the most important thing. But well, India has the best future. We have the best surgeons. They are doing great job. The passion is more than what I had. And this is very, very important. I'm sure 5 to 7 years down the line, we'll have more internationally acclaimed surgeons, because they are acclaimed in India, but I want them to be acclaimed in the world. And there are so many of them. I'm sure it will happen.
Sir, it was amazing, amazingly beautiful discussion today. And as the proverb says that there is a lady behind every successful man. So today we came to know the real uh, lucky lady behind these successful men, sir. And one more thing that you said, that you give and you get the more happiness, more inner peace, whether you give their knowledge back to the society, your time, your efforts, or as a mother, you give uterus to your daughter or to the sisters. So that gives the immense peace and maybe the purpose of your life. Thank you so much, sir. If
Thank
time
you.
permits, I would like to have few rapid fire questions in a
Sure.
very short. So, scalpel or robo? Your favorite
Uh, Scalpel that is open or
laparoscopy? I mean, as a surgeon.
laparoscopy or robo? 100%.
Okay. One surgery that has changed your life.
Radical hysterectomy.
Okay. Okay. Moment in the OT you will never forget. Uh, this birth is okay. Anything else, sir?
The first time that I did live transmission for AHL, and I was given 60 minutes and I finished in 58 minutes saying the dialogue from Guru, "Do minute ka munafa."
2 minute
But they
come.
questioned my timing and then I did it in 50. And that was the most eureka moment. 5,000 surgeons in AHL watching me live at 1 o'clock. That
And
was
I
eureka.
do remember also some of them commented that whether it is a real live patient or you're
Yes,
doing
yes,
in the
yes. So that
cadaver.
was the best moment in my theater.
Yes, sir. Teaching or operating, if you have to choose only one.
Always teaching.
Oh.
Always. Always. Teaching is my passion. We have 10 residents every single day. Teaching is my passion. So we say that in Galaxy, Gada bhi ghoda ban jata hai because every day they hear the same thing, same way. So it's like teaching is my passion any day.
Sir, if not a surgeon, what would you be?
I really don't know. No, but I would have been an artist. Actually, I was involved with my playwrights, and in fact, a movie made on my has gone to Oscar award. If you don't know, it's a Marathi movie, Shwas. So I'm still interested in producing some Marathi plays. That's
Wonderful, sir. One book or movie that deeply resonate with your philosophy of life.
the book that I have always been very, very passionate about, and that has been my torch for this, is that You Can Win Too by Shiv Khera. And that is the book. And I recently met him in the flight, and for 2 hours he was chatting with me, and he gave me another book of his. So it was insane. And his book says that you can win too, meaning what? You can do it too. And that's been my that you can do it too. I always say, because when I was starting laparoscopy, people used to say only experts should do it, 60 hours of endo trainer time and all that. And I didn't believe. So you can win it too. It's sold more than 1 million copies, and I just love it. And the second book that made the best part of it is The World is Flat by Thomas Friedman, who says that the world is flat. America is no longer America. There are better people outside the world doing better jobs than America, which is what we have proved by our endoscopy.
So thank you so much. And I'm sure that viewers would love to watch this again and again, and including myself. And it is really thrilled moment today, sir, with you.
Thank
Thank
you,
you for your
Sejal. Thank you. It
time.
is always a pleasure.
It was
And
really from heart, sir.
always anything to do with my surgery transplant is always from my heart. Thank you very much, and
Thank
hope to see
you.
you soon next weekend.
Yes, sir. Thank you, sir. Thank
Weekend in Abu, no? Not
you.
Abu. Chalo. Okay.
Thank you, and we are grateful to Foxy and Dr. Sunita Tandulwadkar ma'am for initiating such a wonderful platform for all of us and for all the audience. We are also equally thankful to Evangel team for this all the technical support. Thank you, sir. Have a good day. Good night,
Thank
sir.
you. Bye bye. Bye. Bye.